Hello, my dears. I'm back to teach you another lesson about menopause. This is video tutorial 151. We've just completed an entire unit on what happens at menopause, or wham, what happens at menopause. Tutorials 141 all the way through 150 presented themes that affect many aspects of menopause. They grouped occurrences according to similarities. Today's video isn't about a theme involving similarities. It's just the opposite. It's about differences. In this tutorial, I'm going to compare and contrast osteoarthritis with osteoporosis. These are two terms and two diseases that sound similar, but are quite different. So, I think it's important to discuss the differences. The consequences of confusing these two diseases can be profound. If you've ever heard either of these terms, you need to watch this video. If you have one of these diseases, you need to watch this video. If you're vague about either of these diseases, you need to watch this video. So let's delve into the differences between them. This is our buddy today. I call him Boney. He'll assist in helping you distinguish osteoarthritis and osteoporosis. Okay, stay right there. Don't go anywhere. My goal is to point out all the differences between the two, so let's address this by category. We'll compare all of the following: their definitions, their locations, their causes, their symptoms, their progression, their diagnosis, the treatment options, their prevention, and their management. Okay, so let's start with their definitions. Do you already know the differences in their definitions? See if you can answer this quiz question. By definition, osteoarthritis and osteoporosis differ in that A, osteoarthritis involves breakdown of cartilage, whereas osteoporosis involves breakdown of collagen. B, osteoarthritis involves loss of bone mass, whereas osteoporosis involves breakdown of cartilage. C, osteoarthritis involves breakdown of cartilage, whereas osteoporosis involves loss of bone mass. Or D, osteoarthritis involves breakdown of collagen, whereas osteoporosis involves loss of cartilage. Do you know the answer? Is it tricky? You see, this should be easy, but it all depends on whether or not you know the differences in the definitions of these two diseases, and most people don't. Here's the quiz question again. This time the answer is in bold. It's C, osteoarthritis involves breakdown of cartilage, whereas osteoporosis involves loss of bone mass. So, the definition of osteoarthritis is as follows. Osteoarthritis is chronic breakdown of the cartilage in the joints, leading to pain, stiffness, and swelling. And the definition of osteoporosis is as follows. Osteoporosis is loss of bone mass, making the bones porous, fragile, brittle, and prone to fracture. This is a very critical difference. Osteoarthritis is all about cartilage. Osteoporosis is all about bone mass. And that brings us to the next distinction, which is location. Boney here will help us with this. Osteoarthritis occurs in the space between the bones, like between these bones and this bone, or between this bone and this bone. The problem with osteoarthritis is in the space where two bones meet. Osteoporosis occurs within the bone itself, like within this area. So with osteoporosis, the problem isn't in your joints. It's in the bone itself. So here is a segment of the spine. Osteoarthritis occurs in this gray area between these two bones of your spine. So osteoarthritis would be in here. But osteoporosis would occur in the vanilla-colored bone itself. So, using this model of the spine, osteoporosis is inside the bone. So here you have two vertebrae. This side is normal bone. This side is osteoporosis. See, it's within the bone itself. Compare this. There's less bone here than there is here. Okay? So osteoporosis has nothing to do with the joint space between the bones. It has to do with what's inside the bone. There are many different ways to express this distinction between the location of osteoarthritis versus osteoporosis. You could describe the difference as outer bone versus inner bone, or interbone, which means between, or intrabone, which means within. Or you can just say between bones versus within bones. They are all valid ways of describing the differences in location. So use whichever one you want to help you remember the difference. Here, I have a door hinge. It's a rusty door hinge, and it's a perfect demonstration of osteoarthritis. You see the rust that is built up here in this joint space? This is the area between the actual door and the door frame. Okay, when the door hinge gets rusty, the door doesn't move as easily, does it? But the problem isn't with the door itself. It's the hinge that connects the door to the door frame. Well, that's exactly what happens with osteoarthritis. The difference is that instead of rust, you build up particles of cartilage. And just like the rust in a door hinge, the cartilage clogs the joint so that it can't move smoothly. This is a normal knee. See? This area between the joints is the area of focus, between the two bones. It is not this bone or this bone. It's the area where they come together. So here's another knee. This is normal. Here, this knee shows some flaking off of some of the cartilage, and that is depicted by this little red area here. In the normal knee, there was no red. This one has lost some of this cartilage, and that cartilage has flaked off into the joint space. Now here's one that has even more joint damage. See how the red area is even larger? That's where cartilage has flaked off. And finally, here's one with severe osteoarthritis. See all this red? The more cartilage breaks down and flakes off, the worse the situation. So if particles of cartilage collect in the space between these bones that form your knee, it becomes difficult to move your knee, and your knee is stiff, and movement hurts. Osteoporosis is different. It has nothing to do with the joint. It is all about the bone itself. If you're watching my videos in order, like you're supposed to, you've seen this many times before. Osteoporosis is where the quantity of your bone decreases. So instead of this, you lose bone so that it becomes like this. There is less bone here than there is here. So osteoarthritis is buildup of cartilage in your joints between two bones, whereas osteoporosis is loss of bone within the actual bone. And there's another distinction between osteoarthritis and osteoporosis that pertains to location. It has to do with which bones are most affected by each disease. Osteoarthritis is most common in your fingers, your toes. I've got to bring the toe up here. Toes, knees, as well as the hip and the spine. But osteoporosis is most common in your hip, spine, and wrist. So, can you have both osteoarthritis and osteoporosis? Well, of course you can. If that's the case, the bone itself is less dense, which is osteoporosis, but the space where the bone meets another bone is also damaged with cartilage clogging the joint. That's osteoarthritis. Okay, so next is the difference in the causes of osteoarthritis versus osteoporosis. See if you can answer this quiz question. Which of the following is not a cause of osteoarthritis? A, wear and tear on your joints. B, overuse of your joints. C, injury to your joints. D, weight loss. E, joint inflammation. This one's easy, isn't it? Here's the answer in bold. It's weight loss. Weight loss is not a cause of osteoarthritis. The opposite is true. Weight gain causes arthritis. Why? Because it puts more wear and tear on your joints. So osteoarthritis is caused by all of the following: wear and tear on your joints, overuse of your joints, injury to your joints, excess weight bearing of your joints, and inflammation of your joints. There are also genetic factors that can contribute to osteoarthritis. Osteoporosis has different causes. It's due to anything that results in bone loss, and this includes all of the following: estrogen loss, smoking, excessive caffeine, excessive alcohol, chronic excessive exercise, anorexia or bulimia, diabetes, thyroid disease, vitamin D deficiency, and steroid use. So the causes of osteoporosis are things that decrease the quantity of your bone. Osteoarthritis has nothing to do with the quantity of your bone. It's caused by things that affect the joint space. So next we have symptoms. Time for another quiz question. Which of the following are early symptoms of osteoporosis? A, bone pain. B, muscle strain. C, stiff joints. D, humpback. E, back pain. F, poor posture. G, none of the above. H, all of the above. I, B and C above. Don't be fooled. The question is about the symptoms of osteoporosis, not osteoarthritis. If you're like most women, you guessed all of the above. But that's wrong. It's just the opposite. It's none of the above. Here's the question with the answer in bold. Osteoarthritis produces all sorts of symptoms, early, late, and all the time in between. The big problem with osteoporosis, though, is that there are no early symptoms. You just sustain a fracture. Are you starting to see how different these two diseases are? Do you see how detrimental it can be to confuse the two? And now we move to the diagnosis of these two diseases. For osteoarthritis, the diagnosis consists of noticing your symptoms of joint pain, stiffness, and swelling, and getting an X-ray that shows joint damage. But the diagnosis of osteoporosis is more difficult. There are no symptoms. So unless you just sustain a fracture, you need a bone density test to determine if you've lost bone. Getting a bone density test when you begin post-menopause is absolutely critical. When you begin post-menopause, it provides a baseline for future comparison, or it reveals osteoporosis early before you fracture something. Okay, now for the differences in the progression of these two diseases. First, osteoarthritis. Osteoarthritis can begin at any age. However, it very commonly starts at the time of menopause for a variety of reasons. And once it starts, it's chronic. That means it gets worse over time. But it's obvious that it's getting worse. Your joints get stiffer. They hurt more. Your mobility decreases. But the progression is quite variable from one person to another. And that's because you can control many of the factors that cause progression of osteoarthritis, including how much wear and tear you put on your joints, how much you overuse your joints, how many injuries your joints endure, how much weight you gain, and how much you do to decrease joint inflammation. Some joints may become so damaged that they have to be replaced with artificial joints. That's why so many people have knee replacements and hip replacements. The typical osteoporosis of menopause, on the other hand, begins at the time you lose your estrogen. And unless you do something to prevent bone loss, the progression of osteoporosis is very predictable. With no measures to prevent bone loss, you lose 2% of your bone per year in the first 5 years after losing estrogen. 2% every year for 5 years. That's 10% of your bone. And then after that, you lose 1% per year after that. That's a lot of bone loss. So the progression of osteoarthritis is much more obvious, and you can do a lot to monitor it and modify it. But the progression of osteoporosis is silent. You don't know you have it until you sustain a fracture. So now the treatments. The treatments for these two diseases are very different too. You treat osteoarthritis with anti-inflammatory drugs and steroids. But note that steroids cause osteoporosis. And you treat osteoporosis by doing something to replace bone. And your options are to take estrogen or to use one of the SERMs, which I presented in videos 34 and 35. But better than any kind of treatment is prevention. You prevent osteoarthritis by doing the things I mentioned earlier. Put less wear and tear on your joints, avoid overuse of your joints, avoid injury to your joints, and avoid weight gain. And you prevent osteoporosis by taking estrogen or using a SERM. For most of you watching this video, your opportune time for prevention has passed. And these tutorials are all about management of all aspects of your menopause. So let's talk about management of these two diseases. And for each one, I'm going to go through your dietary, your lifestyle, your vitamin and mineral, your herbal, your hormonal, and your non-hormonal options. This is the kind of thing I will be doing for each and every disease and each and every symptom that we cover, and they'll be in much greater depth than what I do right now. But right now I'm just going to list options for you, and you'll see how many choices you have. So for osteoarthritis, there are dietary measures that can reduce the extent of pain and swelling in your joints. These dietary measures include eating plenty of foods with omega-3 fatty acids, polyphenols, which just means grapes, olives, and green tea, veggies that contain calcium, sweet potatoes, spirulina, wheatgrass, and kelp. And it involves avoiding acidic foods like pickles and vinegar, nightshade veggies such as tomatoes, potatoes, eggplants, and cherries, avoiding coffee, alcohol, meat, sugar, and white flour. Now, if you prefer lifestyle options rather than dietary measures, you can manage your osteoarthritis using low-impact exercise like yoga and Pilates, or possibly heat might make your joints feel better. In the vitamin and mineral category for osteoarthritis, you can use glucosamine, chondroitin sulfate, S-adenosyl L-methionine, otherwise known as SAMe, or MSM, which is methyl sulfonyl methane. And if you prefer herbal products for your osteoarthritis, the options are feverfew, aloe vera, curcumin, turmeric, or cayenne or capsaicin products. And you already know that the hormonal option for osteoarthritis is estrogen. And this is because estrogen is a lubricant for your joints. Without estrogen, your joints start getting stiff. That's why a lot of women start noticing symptoms of arthritis, osteoarthritis, at the time of menopause. And the non-hormonal medication options for osteoarthritis are pain medications, non-steroidal anti-inflammatory drugs, and steroids. So there are all sorts of options for dealing with osteoarthritis once you have it, but there is no cure. So your best bet is to prevent it if you can. And now for management of osteoporosis. In the category of dietary options, we have avoiding soft drinks, decreasing caffeine and alcohol, and increasing your soy, flaxseed, green tea, protein, foods that contain vitamin D, and green leafy vegetables that contain calcium. But let me just say, no dietary measure can suffice to manage osteoporosis all by itself. One of the biggest mistakes women make is to assume that they can manage osteoporosis with diet alone. Please don't make that mistake. For osteoporosis management involves preventing progression and preventing fracture. So the first thing you want to do is prevent falls. You know how you baby-proof your home? Well, you can fall-proof your home too. Next, you want to do exercises that enhance the density of your bones. And these include weight-bearing exercise in which you place weight on your bones, and resistance exercises in which you use your muscles to overcome resistance. And then, two of the most important types of exercise for preventing falls are balance and flexibility. And other lifestyle measures for managing osteoporosis include avoiding smoking and getting adequate sun exposure. What about vitamins and minerals for managing osteoporosis? Well, they include calcium, magnesium, vitamin D, and folate. The only herbal option for osteoporosis is phytoestrogens or soy. The best hormonal management option for osteoporosis is estrogen. That's because estrogen prevents bone loss. Lesser hormonal alternatives are testosterone and progesterone, but nowhere near as good as progesterone. And the non-hormonal medication options for osteoporosis are the SERMs. Again, I covered those in videos 34 and 35. Did you notice that the only management option the two diseases have in common is estrogen? If you didn't, take note. Paying attention to overlap of management options makes your life a whole lot easier. So there you have it. All the differences between osteoarthritis and osteoporosis. As you can see, they aren't similar at all. I hope this tutorial ensures that you never confuse the two again. As usual, I've created a chart for you. It lists all the factors we addressed and consists of two simple columns delineating these differences. Here it is. You can find this chart by clicking on the link just below this screen, or you can go to my website, which is menopausetailor.me. On my website, you click on the menu item that says YouTube Video Tutorials. Hover over it, and a submenu will appear. Click on Charts, and you'll see this chart and all the other charts I've created for you. Of course, if you're watching these videos in order, you already have all the other charts. Okay, ladies. Oh, and gentlemen, did you know that men watch these videos too? I just love that. Tune in next week when I'll discuss how your pregnancies affect your menopause. The next 6 videos will cover various topics that you need to understand before we start discussing each disease or symptom of menopause. They're all very practical and everyone should watch them. So I'll see you in a week. Unless I see you for a one-on-one consultation between now and then, or unless you see me on Facebook, Twitter, and Instagram between now and then. In any case, follow me and subscribe, and come back in a week. Bye!